So, hello, Dr. Prithvi
Hi.
Mohandas.
Hi.
First of all, congratulations for the launching of the
Thank
MIOT
you.
Rehab Center in Mauritius.
Thank you.
So, I would like to know a bit more about the Rehab Center. First, I would like to ask you to tell us a bit more about the relationship between MIOT International in India and Mauritius, how it evolved over the past years.
Sure. So we have a very close relationship between Mauritius and India in general. But over the last 3 years, we've been receiving patients from Mauritius for various treatments that are not available here in Mauritius. This is a mix of patients coming from the Ministry of Health, private, as well as insurance. And recently, we've had an even closer collaboration with the Ministry of Health via teams from my hospital called MIOT in Chennai, India, coming here to perform organ transplant, especially kidney transplant. And therefore, we looked at what else we could do here in Mauritius.
And we would like to ask you about the MIOT Rehab Center. How did it all start with in Mauritius?
Absolutely. So initially, in the healthcare space, people realized that simply doing a surgery or giving a treatment in hospital did not fulfill the patient's goal. Nowadays, patients have changed compared to previously. Their demands are higher. Their work requirement takes a lot out of them. So patients want to get back to fully normal activity that they were doing or wanted to do.
Mm-hmm.
And sometimes, even though they've had some kind of treatment or surgery, they go back home or they go back to their country finding that they're not able to achieve their activity goals. So that's why we looked at rehab and we started the second largest rehab center in India in MIOT Hospitals, Chennai in South India.
And what inspired the launch of the MIOT Rehab Center in Mauritius?
Looking at the patients coming to us over the last 3 years from Mauritius, we found that a lot of them had problems related to the spinal cord and brain. These problems actually need sometimes 42 days, sometimes 90 days of rehab, and staying away from their own loved ones and country did not help. The cost was also very high of staying in a foreign country for this rehab. Also, the rehab sometimes can be offered for children, children with cerebral palsy, children with autism, elderly people, sometimes elderly people with Parkinson's disease need rehab. And for all these reasons, we thought the ideal thing to do is to look to offer this at the patient's own doorstep in Mauritius.
And I've seen all over the banners, the flyers that you have mentioned is the first of its kind,
Yes.
world-class rehabilitation. What makes it the first of its kind?
So people misunderstand rehab. The term rehab does not mean physiotherapy.
Yes.
The term rehab also does not mean drug or alcohol rehab alone. It basically means having a multidisciplinary team as well as directed specific modern devices, technology, to help the patient get back to their desired activity. For example, a patient may be a singer, and you're able, after the patient has a stroke, to make the patient comb their hair, even though the hand was weak, or feed themselves, or walk normally. But what they need to do is sing. Or a patient is a teacher and he needs to write on the blackboard. And this patient, say for example, has had a broken arm
Mm-hmm.
and the bone has healed beautifully, but he still cannot hold the chalk and write. So this involves seeing why this particular activity is not possible. Is it a muscle issue? Is it a nerve issue? Is it a confidence issue? Is it a combination of the two? Is it a mental issue? Is something not firing from the brain to the particular area to make the action possible? So you need a team. Each of the team members is a different kind of specialist. You need somebody who can decide how the patient gets back to work, occupational therapist. You may need somebody who decides how the patient is able to sing or speak or swallow, somebody who does speech therapy, voice therapy, language therapy, and so many other things that involve these therapies that complement each other, along with pure muscle exercises, physiotherapy, to achieve the patient's goal. And that makes this place unique and one of its kind in Mauritius.
And why is continuous care beyond hospital treatment so essential?
I think that people misunderstand that they will fully recover just because they're out of hospital. Staying in a hospital is difficult. It can be sometimes depressing. If you're a private, it can be expensive. It takes you away from the family. Also, hospitals are crowded, and sometimes as soon as the treatment is over, you have to go home because the next person is waiting for their care. And although your cancer is removed, although your bone is fixed, although your nerve is repaired, you find that you're not back to completely what you were doing or expected to do after you came home from hospital. And this requires structured, targeted, protocol driven, multidisciplinary rehab. Otherwise, you become disabled.
And can you tell us a bit more about this multidisciplinary team that you have at the rehab center?
Absolutely. So, rehab is not a one man game. Rehab needs a leader and a team that is put together to achieve the goal. The leader of the team is a specialist who has a master's degree in physical medicine, which is what is called rehabilitation medicine.
Mhm.
Such a degree is not commonly found in Mauritius. We have a doctor who's trained, who's Mauritian, who has degrees in orthopedics and rheumatology, who's been trained by us in Chennai for 6 months under the head of rehabilitation medicine. He is stationed here. We have some talent from within Mauritius and specific talent that's not available to come here from Mauritius, to Mauritius from India, stay here for a year. So we have a combination of physical therapists, voice therapists, nerve conduction study experts, visual reality experts, occupational therapists. So all of these in conjunction with the head of physical medicine, with a rehab therapist, will give the patient a targeted goal and customized treatment.
And I've heard that you have personalized treatment plans. Can you
Exactly.
tell us the process behind the creation of this personalized treatment
So
plans?
first, the patient has a consultation. During that consultation, we understand certain things that are specific to the patient's needs. A child has different needs, a young adult and an elderly patient have different needs. Where are they going back? Are they going back home to care for themselves and be independent? Are they going back to work? Are they going to school? Based on this, we look at what are they able to do now, what can they not do. Maybe some people have cognitive disorder, they're not able to spell, they're not able to understand. Maybe some people have motor disorder, they're not able to hold things, grasp things, they're not able to do fine movements. So once we know what they need to do and what they're unable to do, we bridge the gap with a multidisciplinary, personalized, customized plan. It may be for 42 days, it may be 90 days. Every week, at the end of the week, there's a target they should achieve. So they know they're on the road to recovery and in the end, hopefully, to full recovery.
And can you just remind the viewers the type of patients that can come here and the advanced rehabilitation technologies equipments available at the center?
So anybody can come here, from children to youngsters to old people, wide spectrum of diseases. And there's a huge number of technology that's cutting edge, that's modern, that can be used to improve their condition. So if you've got a problem with weakness in the legs or with paralysis, maybe you've had knee replacement surgery, maybe you had spine surgery, then there are gravity canceling devices that strengthen your muscles. Maybe you've got a nerve injury and the nerve is not recovering fast enough, or a muscle injury. Then we have special electrical stimulation, galvanic and Faradic stimulation based on whether it's a nerve or a muscle. And a combination of all these, helps people who are bedridden for a long time, who are scared that they'll fall. We have beautiful machines like the tilt table, like the balance machine called the Ballo, which helps you to get your equilibrium. So these are fascinating technologies in conjunction with specialists that will help you reach your target goal.
And as you said, all type of patients can come here. We must also think about the patient with mobility issues. How does the center ensure accessibility and convenience?
Right from the doorstep, right from the vehicle that drops you off, we have mobility in mind and different ability people coming here in mind. And therefore, we have special ramp that will take you from the car to the doorstep of the center. Another second special ramp that will take your wheelchair or stretcher into the center. And then once you're within the center, we have special areas where you can rest, recuperate in between treatments. And also a large, safe, disabled toilet, which you could use for comfort breaks, which has railings to make sure you don't fall, special toilet that you can use so that your comfort breaks are safe and you can get back to therapy.
And what about the MIOT's next-gen telemedicine to enhance patient care, especially in enabling real-time consultations with a specialist from MIOT International India?
So a lot of patients who've been treated here or patients who've been treated elsewhere and who are coming to Mauritius and who need to rehabilitate sometimes have other issues wrong with them for which the specialist is not sitting here at the moment in Mauritius. They may have heart issues, may have breathing issues, maybe a child that needs to see a psychologist or an autistic child that needs to see a child psychiatrist. We can connect to the specialist in Chennai in real time. We can also plug diagnostic machines into the device so the specialist can see skin problems, ear problems, throat problems in real time and do the consultation and give their advice. So this is not just a video call. This is a device into which you can even connect an ultrasound machine while the consultation is going on. You can put a stethoscope that can be heard. You can put an echo machine, ECG into the device. So the specialist on the other side can give a proper, complete opinion on how to modify or fine-tune the treatment or what extra treatment is required.
And MIOT has a long history behind. Can you tell us a bit about some success stories of MIOT since it opens doors?
So we had so many success stories. We've had children with cerebral palsy that could not even go to school. They've come to us from Kenya. They've spent around 90 days with us. A year later, the child's mum sent us a video of the child walking happily from home to the school bus, going to school very happily. We had success stories with elderly people who had surgery done and who were bedridden, who said, okay, surgery's taken away my pain, but I don't want to walk. And they've come to us. We've got them walking again. We have the story of a young university graduate, finished university, looking for a job, had a road traffic accident, hurt his spinal cord, had excellent surgery, spine was fixed, but his nerves had not come back and he was paralyzed from the waist down. So he spent 3 months with us. We got him walking, we got him exercising, climbing stairs. He went back home, he was able to swim, able to play badminton, and now he's got a new job and he's going to get married. So these success stories obviously make us feel very happy and give confidence to patients who are embarking for the first time on their therapy journey.
And to end this interview, correct me if I'm wrong, I've heard that as from Monday, you're about to welcome patients, right?
That's right. So today is Friday and tomorrow is Saturday. Tomorrow also we'll have people coming here to visit the center, to do a walkthrough. And from Monday, patients will be welcome here. They can walk in here, make an appointment here for an assessment. And then after the assessment is over, they'll be given their treatment timetable.
Once again, thank you for this interview. And once again, congratulations for
Thank
this
you.
rehab center.
Thank you very much.